Okay.
All right, we'll go ahead and admit everybody now. You get him?
Hello?
Hello.
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 Hello, everybody, and welcome to the Marian University DNP FNP info session. We're so excited for everybody to join us. And we'll get started here in just a minute. I know there's still a few people joining, so give us just a minute and then we'll get going. All right, like I say, welcome to the info session at Marian University. We are so excited that you have decided to join us tonight. And we look forward to giving you some more information about our program. And most importantly, we want to answer any questions that you may have. Like I say, we're really excited about the program that we have here at Marian. We're really excited about Layton School of Nursing. And so what I want to do now is I want to hand it over to Dr. Karen Harden. Dr. Harden is one of our assistant deans here at the Layton School of Nursing. So Dr. Harden, take it away.
Thank you, Kyle. Well, first of all, I want to join Kyle and welcome you to our DNP orientation this evening. We're so excited to see all of you on. I wish we could be in person, but another time. I serve at Marian as Assistant Dean of Undergraduate Programs at the Layton School of Nursing. And I am here on behalf of our Dean, Dr. Dorothy Gomez, who couldn't be with us, but she wanted me to share with you that she was disappointed she couldn't join us tonight, but there'll be another time for you to meet her. We're very proud, as Kyle said, of the Evans Center and the Layton School of Nursing. We've been in the building since July 2013. We were the first program that got to move in, and we have a beautiful site. If we could do this on campus, we would have taken you on a tour. We're very proud of the second floor of the Simulation Center, so you could see that. We also would probably be enjoying hors d'oeuvres together down in the lobby if we did this face-to-face. So we will have to do that at another time. I'm looking forward to meeting you. Is there anybody that's a Marian grad? If you could just unmute and say hello, if you graduated from one of our programs at Marian. I'll give another second to see if anybody's there that we know. Well, I know we have a few people that are graduates, so we'll be glad to talk to you at some point. Well, thank you for your interest and your time today, and I am going to stay with you and listen to the program, and I'm going to turn it back to Kyle.
Hey, Karen, can you hear
me? Robert?
Yeah,
I know, I thought that was you, Robert.
How are you doing?
I'm fine. So nice to see you. Robert and his sister both went to our program, and they both did clinicals for us. So when I saw, Robert, your name, I said, is that Robert Petchy? So welcome. So glad to see you again. Tell your sister hello.
I will.
Well, thank you very much, Dr. Harden. So we're going to get kind of into the program. So basically what we're going to do, again, we're just going to give you some information. We're going to show you a video here in just a minute. Like Dr. Harden said, I mean, we really wish you could be on campus with us. We really enjoy having you on campus and showing the facilities, showing everything that we have to offer here. It's not possible at this time, but certainly it's going to be possible in the future. And so we'll try to do some more of these. And hopefully, maybe, possibly in the spring, we could have something on campus. If not, it will be at some point. So we'll let you know when that is. And certainly, if you do want to visit the campus just on your own, certainly reach out to us. We can try to set something up. Again, we're still trying to be cautious, but there are some opportunities that we can create for you. So let us know if you do want to come by and see anything in particular or talk to us, because we are still open to that. So what I want to do now is we're going to show a video, and it's going to show you a little bit about our students and a little bit about the facilities we have here at Marion. So Liz, who is the one that put this great video together, is going to go ahead and share here in just a second.
I was really intrigued by the size of Marion and the fact that I could have faculty members who could work with me if I wanted to do something a little different or unconventional. I wasn't going to just be a number in a classroom, but I was actually going to be somebody who could get to know the faculty and hopefully establish relationships with my fellow students in a way that couldn't be experienced at a bigger university. I am an FNP student at the DNP program at Marion University.
Marion's DNP FNP program prepares our students to be primary care providers in outpatient settings. We prepare our students through on-campus, one-on-one classes. We have small classes, and we get to know our students personally. Our students get to know us.
My name is Dr. Kathy Bach. I am the program director of the Family Nurse Practitioner track of the Doctor of Nursing Practice program here at Marion University. I have been here at Marion University for 2 years now, and it is my pleasure to welcome you here.
I think I'm looking forward in my first year to learn how to assess a patient. All of my nursing experience has been in cardiology, so I think I'll be able to be a little more flexible in my treatment of patients.
We provide individualized instruction, and we form a relationship with our students. We know all of our students. We have on-campus classes and hybrid and online classes, but we do know our students and get to know us. We have a variety of clinical experiences, and their curriculum is set up for across the lifespan courses, and so they can use their patient experiences in any clinical setting. And we are very active with students in helping them, also encouraging them to find their preceptors and then facilitating that preceptor relationship.
I'm Dr. Jeannie Potts. I'm the Assistant Director of the DNP FNP program at Marion University. The program consists of 8 semesters. The first year are core courses, and there's no clinical. Your clinical starts in the fall of the second year and continues through until the end. In addition, the DNP portion of the curriculum, you will be doing a quality improvement project in a clinical site of your choosing. Faculty work very closely with students to develop the program, develop the project, and see it through to completion. Applicants do not have to have any professional experience. They do need to have graduated from an accredited nursing program and have passed the NCLEX and be an RN.
We have 10 exam rooms, all the equipment that we would have in a standard provider's room. We use these rooms to do physical exam checkoffs. We also use these rooms to allow the students to be able to do what we call standardized patients, to help them prepare for when they go into their practicums and are ready to take care of actual patients. Each of the OSCE rooms have cameras in the ceilings where we can record what goes on in the OSCE rooms so we can give them feedback on their assessments, on how they're doing during their physical exams. They can also utilize the videos to critique themselves. We also have new simulated equipment that we can use to teach otoscopic and ophthalmic exams. In doing these exams on these simulators, they're able to do it in a safe environment. We use standardized patients during their practicum classes to assist them in learning how to do a full physical assessment and come out and what we call staff the patient with their preceptor to make sure that they are ready to go into their practicum classes and prepared to tell their preceptor exactly what their plan is with their patient.
I looked at a lot of different options, and when I saw the DNP FNP program, I realized, you know what, that's what I want to do. That's what's going to fit who I believe I am as a person and what I have to offer the world.
All right. Thank you very much, Liz. That just shows a little bit about, again, the background of the program and some of the great facilities that we have here at Marian. And remember, it pointed it out in the video, but this is a BS in the DNP program. You're going to be a doctorally prepared nurse practitioner with the FNP, Family Nurse Practitioner piece. And so you will be a DNP when you graduate from Marian. So we think and we know by talking to our healthcare partners and our hospital partners that is a very highly desired piece. Having the DNP, we know that there's other options, but we know that our healthcare providers very much want doctorally prepared family nurse practitioners. So we think that is what's going to prepare you best for your advanced practice care moving forward. So now what we want to do is move into the next part of the program, and that is Dr. Bach and her team talking more about the specifics of our program here at Marian and telling you a little bit more about that. But one thing, before I throw it to Dr. Bach, what I want to do is just remind you, please feel free, if you have questions, use the chat box. We will either answer them now just by typing them out to you, or we can also, we'll also answer questions at the end. So please feel free to use that chat box for any questions that you might have that come up during the presentation or that you have right now. Hopefully we'll answer a lot of them through this time, but certainly that's what we're here for, is to answer any questions that you might have. So please feel free to just type a question to everyone, or if you don't want to type it to everyone, certainly feel free to choose me in the drop down, and I can get that question answered for you. So now let's move into why you're here, and that is to learn more about this terrific program that we have here at Marian. So Dr. Kathy Bach, who is the director of the Family Nurse Practitioner track of our DNP program. Dr. Bach, go ahead and take it away.
I think
Dr. Bach, I think you're on mute.
I do that every single time I'm muted, no matter what meeting I'm in. I forget to unmute myself, and I do apologize. Good afternoon. My name is Dr. Kathy Bach. I have been here at Marian University, as I said in the video. I've been here a little over 2 years now. I came to Marian University from Cleveland, Ohio, and I have been so excited to be here, and I'm excited to be here tonight and to see all of you, see all of your names and some of your faces. I am glad to see so many people excited about going forward in your education. The first thing I would like to do is just take a moment to introduce the team. My name is Dr. Kathy Bach. I am a family nurse practitioner. I am not from Indiana. I have to admit, I bleed scarlet and gray because I am a Buckeye through and through. I'm originally from Central Ohio. I moved to Indiana because I love being a part of the doctoral programs, and I love being able to grow programs. When I got here, we were in the middle of our first cohort, and I'm proud to say that cohort graduated, and all 7 of the people in that cohort passed their certification exam with flying colors. In fact, several of them took both certification exams and passed both certification exams, and all 7 of them are now employed out in the area. A couple of them are actually teaching as we speak, and working. A couple of them are working part-time and teaching full-time, and a couple of them are teaching part-time and working full-time. So there's lots you can do with a doctoral degree when you finish with your schooling. So before I get into information about the program itself, I would like to have the rest of the team introduce themselves. So at this time, I'm going to have the team introduce themselves. Dr. Potts, you can go first.
Hi, everyone. I'm Dr. Jeannie Potts. I'm thrilled to be here, and I'm thrilled to have so many people here this evening. Like everybody has said, we sure wish we could be in person, but we can't. So this is the next best thing. I am a dual certified women's health and family nurse practitioner, and I have been a practitioner for many years, over 30, give my age away there. And I've also been in the academic arena on and off for several years. I come to Indianapolis area from Indiana State University in Terre Haute, where I taught in their FNP and doctoral program. I've been at Marion as the assistant director for just a little bit over a year, and I love it. I love the in-class interaction with students and getting to know students, and I just think that if you apply to us, you will be very pleased with your educational journey. And I'm going to turn it over to Dr. Fox.
Hi, my name is Dr. Tara Fox. I'm a pediatric nurse practitioner by trade. I originally am from the South and moved to DC right after I graduated, working there in pediatrics and infectious disease for 7 years, and then worked in the ER setting too for about the ER urgent care setting for about 2 years before moving to Indiana. I got my doctorate from Georgetown and was looking for and knew that I wanted to teach. That was part of the reason I got my doctorate. And I knew I wanted to stay in a school that put service first. So that's one of the reasons that I looked at Marion. I also have really enjoyed teaching over the last year in this program because the classroom's so small. So I've gotten to meet all of the students and learn all of their backgrounds and give them the individual teaching experience that, you know, I wish I had when I was at my DNP program in some ways, which was a lot larger. So, you know, I'm really excited for everyone to be here, and I hope that we can be a good resource for you going forward, trying to figure out if Marion's a good fit for you.
Thank you, team. Okay, well, I have a very short little PowerPoint that gives you some information about our program. So I'm going to share my screen and give you some information about our program. Can everybody see my screen? Is it showing up okay?
Yes.
Okay. All right, so welcome to Marion University. Let's see if I can get it to work. Okay, so before I go any further, one of the things I would like to ask, and feel free to unmute yourself and answer this question. Why would you want to become a family nurse practitioner?
It's Robert Pedke. I did about 8 years in the hospital on an oncology unit. I did about a year in an emergency room, and just really am fascinated with oncology and infectious disease. And so I just I'm to the point where I'm feeling pretty competent as a registered nurse after 15 years, and just want to take the next step. I just want to get smarter and be able to be a little more involved in the direction of patient care. So.
Thank you, Robert. Anybody else? How about this other question? What makes the doctorally prepared family nurse practitioner different? Anybody want to venture that one? There's no test at the end of this. There's no wrong answer. How about some of my faculty? What makes you different?
One of the participants in the chat room said that's what I was planning on asking during the meeting. So you beat her to it. You beat her to it.
Okay, so Jean, what makes the doctorally prepared family nurse practitioner different?
I think that as being a doctorally prepared nurse practitioner, we are very interested and focused on transformational nursing and transformational practice using evidence-based practice, and really implementing the evidence-based practice and research that we read and do into practice.
I think that's the most important piece is making what we know about what's put out there that should work, does it work? And not only does it work, but does it work for the patients that I take care of? And that's the important piece, is knowing how to determine, am I using the best evidence that my patients need? And is it working for my patients? And how do I know that it's working? Because if I don't know how to determine if it's working, how do I know? And that's where being doctorally prepared really makes that difference, because we know how to determine what's the best evidence, how to use that best evidence, and how to determine if it really is working. So, what's our curriculum like? Dr. Potts alluded to the fact that we do have 8 semesters. We have 71 credit hours. Our first 4 semesters are our core, what we call our core courses. They prepare you for your practicum courses. They prepare you to do your DNP project. And they make up the foundation for achieving your DNP program objectives and for achieving what we know are the DNP essentials. The DNP essentials are what our accreditors have put out as what's the important things for a doctorally prepared nurse practitioner to have achieved by the end of their education. And it's important that we make sure that you as a doctorally prepared nurse practitioner meet those essentials. Our doctoral program objectives are the objectives that we as faculty have developed that we feel are our way at Marian University, that we help you achieve those DNP essentials that the accreditors have put out. And these are our 13 DNP program objectives. And our goal is to make sure that these 13 DNP objectives are built into those courses that you're going to take across those 8 semesters. Now, that doesn't mean that all 13 of these objectives are going to be in every class, because that would be pretty overwhelming. But by the time you get to that last class, somewhere amongst those 8 semesters, you will have met these 13 objectives across those 8 semesters. And we help you to see each semester where you meet these objectives and what of these objectives you've met and how. And those 8 objectives help you to meet these, or those 13 objectives help you to meet these 8 DNP essentials. And these DNP essentials are what our entire curriculum is built around. So those first 4 semesters, we start everything in the summer. And we start out with epidemiology, because you have to learn how to look at the big picture. We take theoretical foundations of nursing practice, because everything is always starts with how did we get where we are in nursing? And it all started with our nursing theories. Now, we don't go back too far into all those grand theories, because that's not what we're going to use in practice. We concentrate on what are those theories that we can use in practice. And then, of course, the loving class that everybody knows and loves, physiology and pathophysiology. Physiology and pathophysiology build the foundation for learning your pharmacology and learning your fundamentals in your practicum classes, so that you have that base for what's going on in your patient. Because if you don't know the normal and the abnormal, you can't figure out what's going on. In fall, you move into health assessment, nursing research, where you start building and figuring out kind of where you want to go with that DNP project. Start thinking about, what's my passion? What do I love to start working on towards in terms of, what am I interested in making a change or seeing changes, or seeing myself working towards in my future. And you may know that, but that may be something that may change over time too. And then, of course, the scientific foundations for the family nurse practitioner. What are you going to do? And then, of course, in your spring semester, we go into pharmacology, because we got to know drugs. You got to know what you're going to prescribe. We look at analytical methods for the translation of evidence into practice. That's a really long name for what we shortened down to evidence-based practice. We call that our EBP class. And then, of course, there's information management. We call that informatics. That's how do we take this information and use it. In summer, we go into clinical differential judgment and diagnosing. That's our differential diagnosing class. That's how do we take the information that we know about our patients and narrow it down into what might be wrong. What might we be seeing in this patient? We have, and we're also taking program systems planning and quality improvement. That's our QI class. And then current events in primary care. That might change a little bit. We're working on making a possible move in the curriculum and moving that class to summer of the second year, and moving behavioral health into this one so that you have a behavioral health class prior to going into your practicums. Current events is kind of self-explanatory. It is what's going on in the world today that is important for us to know about as we move into primary care. Your second 4 semesters, in the fall, you move into your first practicum class. This is your first time you're going to be in clinical. You'll be doing 90 clinical hours at that time, and this is the first time you're going to start thinking about that DNP project too. You'll be working on what's the question that I want to ask? We work on what we call a peacock question, and you'll learn more about that in your research class. We also will be taking at that time policy organization and finance. That policy class is an important class because as advanced practice nurses, it's important for us to get involved in policy at the local level, at the state level, and at the national level. I mean, look at us right now. We are in the middle of a very important national election. And it's important for advanced practice nurses to be at the tables. In spring of the second year, we're in professional leadership. Collaboration is an important piece of what we do as advanced practice nurses. On our DNP project, we're working on IRB approval and implementing that project. And you're in your second practicum classes where you're doing 135 clinical hours. And in the summer is that behavioral health class that we are hoping to flip to just prior to your first practicum classes. That's actually getting ready to go to the curriculum committee for approval. So that might be a slight change for next year. The class won't change, just the sequence of it might. In DNP, we're doing dissemination. We're finishing the project. We're working on writing up that final project paper, and you're doing a poster presentation. This is where and in all 3 of your DNP courses, you're working very closely with your faculty chair and working on that project, getting that project down into what you want to do, finessing that project, getting IRB approval, gathering your data, doing your write-up. Your faculty chair will work with you to edit your write-up, and our goal is for you to have a publishable paper when you finish up so that you can get it out there and get information out there to disseminate, to show people that what your work shows that evidence-based practice does work, or if it doesn't work, what needs to be done next. In your primary care class and your practicum class, you're doing another 135 hours. In that final semester, 8 semesters, but that final semester, you're doing primary care immersion where you do 270 hours of clinical, where you're pretty much taking care of the patients on your preceptor is there, but your preceptor is expecting you to be able to take care of the patients, and she or he is there to do a final check, but you're pretty much the one making the decisions on how to take care of the patient. They're there to do a final sign off on it, but you're making a lot of the decisions yourself. And our FNP comprehensive class, we provide for students a online review course in preparation for taking the FNP comprehensive or certification exam, so that students are well prepared for that certification exam and can pass it with flying colors. And this is what it looks like all together. And we already met the team. Should have put that at the beginning. That is.
All right. Well, thank you very much, Dr. Bach. And so remember, hopefully you have been writing down all your questions. And so in just a minute, we'll give you a chance to, like I say, you can put them right now into the chat. And if you want to unmute yourself here in just a second and ask questions, we will do that too. But really quick, I wanted to just talk about really quickly just the admissions process. We tried to make this process as easy as possible. Linda Overholt, who is on this call with us, she is our graduate admissions coordinator. She does a wonderful, wonderful job working with all of you, answering any questions you have in the application process, through admissions, getting you to the point where you're ready to go with your file. So any questions that you have, and I'll put it in the chat here in just a minute, but any questions that you ever have during the process, please email us at gradmissions@marian.edu or give us a call. You can contact us as well. And we're here to help. And Linda does a great job of helping you through that process. If you're having questions about certain things that we're requiring, if you're wondering if something meets the requirement or not, just let us know. The process is pretty plain and simple. To apply, I know that a few of you have already applied, and hopefully a few more of you are getting ready to apply. So it's a really simple process. If you just go to Marian's homepage, in the right-hand corner, there's Apply Now. That's where you can go. When you click there, it'll take you to the screen that's got the main Marian application. Just click on that, and then you'll create a profile and start your application. Again, you're going to be looking for the DNP nurse or not nurse anesthetist. You're looking for the family nurse practitioner track. So that's what you'll select. For our program, the prerequisite, there's just one true prerequisite, and that is a upper level statistics course. So you'll need to have that. That needs to be completed by the time you matriculate. So it doesn't have to be completed yet, just by the time you start classes. And so we'll obviously need transcripts for that at least a week prior to you starting classes. So that's the one main prerequisite. For the program, you do have to have a BSN. It does have to be from an accredited ACEN or CCNE program. Regionally accredited university as well, or college. You do have to have a current RN license. Now, technically, it can be from any state to apply, but again, by the time you start classes here, you will have to obtain an Indiana nursing license as well. So you do need that. And then we do ask for 3 letters of recommendation. You will do a fun little essay for us and tell us about why you want to come to Marian and be a part of this program. And then there is an interview part of this program as well. So you interview with our faculty here at the Layton School of Nursing. Like I say, the application process is really easy, but if there are questions during that process, our office is here to help. So what I'm going to do now is let's turn it over to questions, and we'll try to answer anything over the next few minutes. We will try to honor everybody's time. So we'll try to cut this off right at 5. If there's questions that haven't been answered at that point, we'll get back to you. But we'll also, like I say, I'll put our email address in the chat here, and you can contact us there as well. So I know that I'll help answer questions, and Dr. Bach and her team will answer questions as well. So it looks like the first one is regarding the prior cohort. Was the DNP FNP student able to work and continue to be successful in the program? Understandably, this involves personal attributes of the student, but in general, is the program full-time, etc.? So Dr. Bach, I'll let you take that.
Thanks for the question, Jody. We have had students work during the program. We do try to make sure that classes are scheduled. The first year especially, we try to make sure all classes are scheduled on 1 day a week. Once you are in practicums, it's a little more difficult to work full-time, just because you do have, not only do you have class 1 day a week, but you also have clinical days that you need to schedule. And those clinical days are based on what your preceptor schedule is. And so it's a little more difficult to work full-time based on the number of clinical hours that you will need. But we have had students that have continued to work at least part-time or per diem. What we do ask is that if you are having difficulty academically, we will counsel you and ask you how much you are working and suggest that maybe you might need to cut back on work some if it is affecting your ability to concentrate on schoolwork. Just because we want you to be able to be successful. I hope that answers your question.
So the next question is, what exactly is the upper level statistics course? So basically what we're looking for is it has to be, if you took it as an undergrad, it has to be at least a 300 level course or above. We would suggest a graduate level, but if it is an upper level, we will take a look at that. If you don't have an upper level statistics course, Marion does offer one. And contact our office. It's a fully online course, and we do have one that will be starting with our spring semester that will make it in time for you to matriculate here in the summer. So just reach out to our office. We do have some information on the website about that as well, and Linda can help you get all set up for that. Next, we have our clinical sites and preceptors selected by the program, or does the student find their own? Dr. Bach.
I'm going to let Dr. Potts answer this question
because
he has done more work on preceptors than any other person in our entire program.
I would tend to agree with that, Dr. Bach. So thank you. It's an endless task, let me tell you. But so to answer it briefly, we do want the student to try to find their own preceptor. We are not 100% responsible for finding your preceptor. Although, with that being said, I want to say that we work together, and it really is kind of a 50-50 thing, because most of the institutions or the organizations in Indianapolis will only precept you if you're an employee of that institution. And there are some other freestanding ones that we can get you into. So we always want you to be aware of the deadlines for application for preceptors and those type of things. Although I can tell you that I have quite a few preceptors up my sleeve, quite a few sites that I can get people into. And so we just work very closely with you. How do I say this? You're responsible, but we are responsible also. We will not let you not have a clinical site. We work endlessly on it. And right now we're working for spring for our students, and we almost have everybody placed. I think we have a couple that we're still working on only because of situations. And so I know I probably sounds like I'm double talking. So what I want to say is, yes, you are responsible for finding your preceptor, but yes, we are responsible for helping you find your preceptor. And so it is a two-way street, and we will both work together. Did I answer your question? Who was that? Allie? Did I answer your question? I hope I did.
All right, that is the last one I see on the chat. If anybody, I'll give you, I don't want to put out a lot of awkward time, but I'll give you just a few seconds. If anybody wants to jump in and ask a question at this point, go ahead, and this is your time.
Don't everybody jump at once, okay?
And that's okay. That sounds like we hopefully answered most of the questions that everybody had coming into tonight. I did put our email address in there, and our office works very, very closely with the program office. So if you have any questions, it doesn't matter if it's an admissions related question, if it's a program related question, send it to gradmissions@marion.edu. If it's something that we want the program to answer, then what we're going to do is we're going to get that message to the program. They're very quick about responding, and then we'll get that answer back to you. So we'll make sure that whether it's program, whether it's admissions, that you get your questions answered at any point. So use that. I think Allie has one more question. Allie, jump in.
I think Tiffany has a question also. She's unmuted.
Okay. So Allie, go ahead, and then Tiffany.
Okay.
Allie, I think you're muted if you're trying to talk.
She put it in the chat.
Okay, perfect.
DNP only or FNP only, or are they combined? How do you classify it as DNP FNP? Okay, Allie, we have our program is a doctoral of nursing practice program with a family nurse practitioner track, and we have two tracks in our doctoral program. We have an FNP track and we have a CRNA track. So you graduate with a doctorate in nursing practice with an FNP track. So you're qualified to sit for family nurse practitioner certification, but your degree is a doctorate of nursing practice. So you would graduate as Dr. Quick, family nurse practitioner. Does that make sense?
That sounds pretty good, doesn't it?
All right, perfect. And Tiffany, did you have a question?
Sounds great. We all want that behind our name. So I am a senior at Anderson University working on my BSN. Do you guys accept new grads?
When will you graduate, Tiffany?
So I will be graduating spring of 21.
You graduate in spring of 21?
Yes.
You would have to, we start in our admission starts in summer of 21. So we start in May of 21. So you would have had to have taken NCLEX by then because you have to be an RN.
It's okay, honey. I'm still coming to y'all.
Okay. So what you can do is if you haven't graduated by then and taken NCLEX, you can plan on coming into our 2022 class.
Okay. Okay.
So
if
we'll work
22 just as long as I'm done by May.
Yeah, and you have to have passed NCLEX by then.
Okay. Okay. Awesome.
Because you have to be an RN already to enter the program is the thing.
Okay.
And that's a
they're not.
Yeah, that's a great question, Tiffany. Yeah, that is the one drawback to the start in summer, as we know a lot of people do graduate in May. If you graduate in December, then yeah, you would have time to sit for your exam and then come into the program. But since Usually you're going to sit for your exam after you graduate with your BSN. Usually that's, a few weeks later. Then normally new grads are not able to start that first summer, but we'll start the application process. We always open it right around September 1st. So we'll open it next September 1st for the next process. We always start in May. That's our one start per year. So certainly we would look forward to seeing your application at this time next year.
Awesome. Thank you, guys.
Thank you, Tiffany.
Jody, your question was, if you work at a site such as Eskenazi, do you have precedence to complete preceptor phase there? What we ask students to do is we ask any student that works with a particular health system, we ask them to apply for a preceptorship with the health system that they work with. And that health system works with that student to place them with a preceptor within their health system, because they want to keep their employees working within their health system once they graduate and come back as a nurse practitioner. So they'll work with you to place you within their system with a preceptor. But you have to follow their rules and get your applications in on time, et cetera, et cetera. So yes, they will place you within their system with a preceptor if they have a preceptor available.
I want to add to that too, Dr. Bach, if you don't mind.
I would gladly add to that.
So you can apply through your health system, and we pray and hope that they will give you a preceptor. But because of all the students, and it's not just FNP students, it's medical students and residents and PAs and everybody, sometimes they get overwhelmed. And so there's no guarantee that you're going to get placed through your health system. We hope you do. We pray you do. And until COVID hit, it usually happened. And we got a little backed up they got backed up on their placements. And so it's not a guarantee, but that's your first line of getting a preceptor. And just like Dr. Bach said, you have to get your applications in through your health system at their deadlines, because a lot of them won't even accept you after their deadlines. The other thing is there's a couple of health systems that will take other people that work at other institutions or other health systems. And so, you're not, if you're not work at one of the health systems in the Indianapolis area, we still have opportunities for you.
And as far as does alumni of Marian have precedence for placement, we use a rubric when we're scoring students' applications, and that there is an extra bonus points given to Marian alumni on the rubric. You do get a bonus point if you are Marian alumni. Pardon?
I did not just hear that.
I'm sorry, Tiffany. I can tell you though, Tiffany, it's never not kept anybody
from being accepted.
Yeah. But they do get a bonus point.
It's okay. During my interview, I'm going to wear the brightest orange Anderson University shirt I can.
We're going to look for you, Tiffany. We'll know it's you.
Well, Tiffany, we certainly do have a few Anderson graduates in our different programs at LSON as well. So you won't be alone, and we appreciate that. And Jody, we also look forward to hearing from you about your application. So does anybody, it looks like everything we've answered. Does anybody have any more questions? I want to respect everybody's time. We have just a few more minutes, so I'll give you 10 seconds to ask any other question.
Hey, this is Robert. Hey, as far as letters of recommendation, I'm going to be, I might get a letter from a couple older people that aren't real IT savvy. I mean, do I just take a picture of the letter or?
So with our process, there's actually a process for them to do that, submit it all online. If they're having issues with that, then what we would ask is that they'll work with Linda over. Linda will help you through that process. We understand that there can be some difficulties, but we do, as much as possible, ask that it's submitted online. All they have to do is upload a document. But if they're having trouble, please have them, or you can reach out on their behalf to Linda Overholt at the gradmissions@marian.edu email address, and we'll help you through that process.
Okay, great. So like, if someone accepts writing me a letter, I can have them just contact Linda?
Yeah, so what'll happen is when you fill out the application, you'll actually put on that application who your recommenders are. And then that system actually, you can put a little note into them, but that system will actually send an email to them, and it will tell them what they need to do.
Perfect. Okay. All right. Thank you.
All right. Absolutely. Good question. All right. Well, thank you so much, everybody, for being here tonight. We really appreciate the time that you took to listen to our program, to ask all of your questions. But we know that you may be sleeping tonight. You may wake up in the middle of the night and decide, hey, I forgot to ask this question. So if that happens to you, certainly reach out to us. That's what we're here to do. But otherwise, I know Liz has put on there, we want to do better. We always want to do better. So there is a survey that we would love for you to fill out. That is in the chat as well, and get your feedback, and if we can do anything better for next time. Like I say, we'd love to have you on campus at some point, and we'll let you know when that might possibly be. But if you do have questions, or you want to just, like I said at the beginning, if you want to come by and see the campus, certainly contact our office and I can set something up with you. Otherwise, everybody have a wonderful evening. Thank you for being here. And we hope to see you, whether it's this year or next year, in the application process. And we would love to see you become a doctor and then your last name after that. So have a great day. Thank you for joining us tonight. And we'll talk to you later.
Bye, everyone. Thank you.
Thank you.